Hi, my name is Dr. Robert Kaufman, and we're about to go beyond the terminus. There are situations in which you simply cannot fit a gutta-percha cone in the normal manner when you're attempting to use vertical compaction of warm gutta-percha technique. Most often these cases have complex anatomy, have deep splits, or involve teeth where the roots are so small it's very difficult to be able to get a reasonably sized gutta-percha cone into the axis at the same time if you have multiple canals. If you pack one gutta-percha cone and then attempt to pack a second one, the first one sometimes blocks off access to the apical sections of the second canal, creating a problem. A Boston University graduate by the name of Dr. John Stropko developed what is known as the System S technique to address exactly those type of situations. As canals became less and less tapered, it became apparent that gutta-percha cone fits were becoming more and more difficult to achieve, especially with smaller axes. And most importantly, Dr. Stropko felt that the apical section of the gutta-percha cone was not receiving adequate heat during the warm vertical compaction technique to allow for it to become plastic, essentially remained cold, and therefore didn't really move adequately. For this reason, he invented what is known as the System S technique, in which a device such as an obtura or other gutta-percha heated gun delivery system is used in combination with the vertical compaction method. I was fortunate enough to visit and become friends with Dr. Stropko over the years. I learned this technique, which has become extremely valuable in cases where conventional classic gutta-percha cone fits and warm gutta-percha are not easy to perform. Dr. Stropko emphasized that the apices of these prepared canals must be kept small enough that it prevents gross extrusion of the gutta-percha filling material during obturation. Meticulous preparation of the canals is necessary to obtain the proper apical taper and allow for the insertion of the material with the proper apical control. Once the canals have been prepared and dried, a small amount of sealer is applied to the canal using a file or paper point. The idea is to coat the canal but prevent extrusion of gross amounts of sealer during obturation. In the earliest days, the obtura device, which was originally developed by a gentleman by the name of J. Marlin, was used, but we now have similar cordless devices that pretty much work the same way. I'm using an B&L Beta. The needle of the gutta-percha gun is introduced into the canal until it binds. At that point, we withdraw it slightly to ensure that the applicator tip does not bind during insertion of the material, and then slowly inject the warm gutta-percha material. Dr. Stropko originally used what was called Schwed brand gutta-percha pellets. The canals are filled to approximately 2/3 of the way to the top, and an appropriately sized plugger is plunged into the warm gutta-percha with vertical pressure and held there. The material moves to fill the canal space, and if the canal has been properly prepared, there's remarkably little extrusion other than perhaps a tiny bit of sealer. The plugger is withdrawn, and the void created by the withdrawal of the plugger is filled with a second injection of the material to complete filling of the canals. I've always been impressed with how much detail this technique creates in the final completed case images, and how extrusion really isn't a problem if care is taken during canal preparation. Note that this method should not be used in cases with large apices or open apices. However, it can be used in cases where apexification has occurred and we do have an apical stop, even though the canals are large. This most often occurs in pediatric trauma cases, and instead of using the smallest needle size for the gutta-percha gun, I will opt for the largest possible size and most often pack the canals gently with a large conventional stainless steel plugger such as a number 10 or number 11. While I don't routinely use System S for obturation, it's an invaluable in cases of severe dilaceration, very sharp bends, and when conventional gutta-percha cones simply don't go to place easily. Here's an example case that I recently completed with this technique. A 54-year-old female patient recently was referred to my office for endodontic treatment of a mandibular first premolar. The adjacent cuspid had been extracted many years ago, and this premolar presented with a draining buccal sinus. Pulp tests were non-responsive, and radiography showed a radiolucent finding of endodontic origin that had both apical and lateral components. I suspected that the tooth may have two canals as well. Treatment was initiated and the canals were cleaned and shaped. The apical portion of the canal was extremely curved and difficult to negotiate, and I had a lot of difficulty obtaining and gutta-percha cones fit for these canals, never mind The second lingual canal, calcium hydroxide was inserted into the canals for 2 weeks, and upon patient's return, we noted that the sinus had closed. My initial cone fit attempts with sealer were unsuccessful, and I was unhappy with the apical extent of the cone location. It was at that point that I decided to use a System S technique to obturate the canals. A small amount of sealer was put on a number 10 file and introduced into the canals. Subsequently, a paper point coated with sealer was also introduced, and then a third dry paper point was inserted to remove the gross sealer excess. A B&L beta tip was introduced into the canal to the point of binding and then withdrawn slightly. The canals were injected with warm gutta-percha at a gun setting of 230 degrees. A green Dovegan plugger was immediately used with apical pressure. A second plugger was then placed in the second lingual canal as far as it would go, so pressure was applied to both canals and held for about 10 seconds. A confirming image was taken at that point, and I was pleased to find that both canals had been filled with minimal apical extrusion. The gun was reintroduced to fill the spaces created by the voids left by the plugger insertion, and the access was closed with composite. It takes a bit of practice, and most importantly, the canals must be prepared with conservative apical sizes to prevent extrusion. The System S technique is an excellent tool to have in your toolbox when classic conventional cone fits are not possible. Thanks for joining me on this trip beyond the terminus. Remember, when we do the right thing, we both get better. Patients and clinicians. Please remember to like and subscribe, as this channel is not sponsored by any commercial entity, and it relies upon you to help spread the word and for it to grow. I look forward to our next trip when we go beyond the terminus. See you then.